Welcome. Thank you so much for being here as we kick off our football series with Banner Sports Medicine. Today we're talking about what student athletes can be doing in the off-season to get prepared and how they can design their own health and wellness program. We're joined by Dr. Steve Erikson, who is the Chief of Primary Care Sports Medicine with Banner. Thank you so much for taking the time to chat with us about this.
Thanks for having me.
Okay, so let's get right into it. What should student athletes be doing in the off-season to get ready?
This question, I think, really they should ask, what could the person across from me or that I'm going to be playing against, what are they doing in the off season? And it's all about the competitive advantage and creating that motivation for that student athlete. So if you're getting 6 hours of sleep because you're staying up playing video games, and they're getting 8 to 9, who has the advantage? If you're dehydrated when you go to practice and they're hydrated every time when they go to practice, who has the advantage? If they're eating 3 square meals and snacks and really looking at their nutrition and you're eating junk food, who has the advantage? So that's what it's all about. It's about creating those habits to do the right thing that's going to make you more athletic, make you healthier, and put your performance at the next level.
Really, really good points and good reminders for young athletes. I know everybody wants a quick fix too, right? But when it comes to getting your body ready when you're competing like this, there really isn't one, right? And in fact, they can be dangerous.
Right, there is no quick fix. If you go into GNC, when we talk to professional athletes, we tell them if you go into GNC, even to look around, you're probably dirty. Because supplements are not regulated by the FDA. Supplements are they're part of food. And so what it says on the bottle and what's in the bottle are not necessarily the same thing. They did a study about creatine about 10 years ago, and they went to GNC and they bought 10 different bottles of creatine and they studied them for purity, and the most pure one was like 90% pure. And there were baby powder and rat poison and fillers and ephedrine and lots of other things in there, because they want their supplements to work. So many times they put illegal substances in there because that's what actually works. But those also create positive drug tests and health issues related to anabolic steroids or even pseudo anabolic steroids.
Wow, that is really, really alarming. The last question I want to ask you is about specialization. Is it okay to cross-train? And at what point would you want to try to pick just one sport if you need to?
Yeah, so we try to keep people away from sports specialization as long as possible. And in the off season, we actually encourage them to play other sports or to cross-train, because when you look at sports specialized athletes that play volleyball year-round compared to their counterparts that play soccer and softball and volleyball, the ones that play multiple sports are actually way more athletic and less likely to get injured.
Very interesting.
The ones that play the same sport the entire year have a lot more burnout and have a lot more overuse injuries.
All right, great information. Dr. Steve Erikson, really appreciate your time. Thank you so much.
Thanks for inviting me.
And thank you for watching. We'll see you again soon.